All right. Well, I was looking through the participants and I don't recognize too many names, which is actually wonderful. I'm really delighted that all of you came tonight to meet us. I can't wait to hear your questions and tell you more about our department and what we do in the Autism Services Branch. My name is Lauren Libero. I'm the Autism Specialist at the department. So I've been with the department since 2018 in this role. So I oversee our autism program services policy and the work of the branch. And we'll tell you more about the branch in the presentation today. Before I joined the department, I was a UC President's Fellow at the UC Davis Mind Institute. So my background is in research, neuroscience, looking at clinical markers related to autism and child development. And now my role brings that data lens to what we do at the state to inform our policies and program. And I also, I'm living in Sacramento, and up here, I also run a group for women on the autism spectrum. So it's a social support group that meets on Thursdays, a little similarly to some of the programming with your group. So that's another reason why I was really excited when Judy invited me because I feel, connected to all of you in that way. So. I'm also here with Monica, who's from DDS, and I'll let Monica give you an introduction.
Thank you, Lauren, and hi, everyone. Good evening. Happy St. Patrick's Day. I'm Monica Hudnall, and I am currently the Autism Training Director. And so what I do is I lead efforts in development, delivery, and evaluation of educational programs and trainings related to autism. And I come with 8 years of clinical experience as a speech language pathologist. And I've worked in public and non-public schools, as well as early intervention. And my clinical specialties are, of course, autism, complex communication needs, including AAC, augmentative and alternative communication, and culturally responsive practices. So thank you for having us here today.
Okay, so we have, if you've opened the presentation, a lot of slides, a lot of information. We're also going to share with you a little bit of data. So if you are a data geek like me, we'll see a few graphs. If you're not, don't worry. I'm going to walk you through what we have here. But really, we're going to talk about the DDS system from a high level. We'll tell you some details about our Autism Services Branch, why we formed, what we do, and what we hope to do in the future. And then we're also going to share about some of the DDS programs and our newer initiatives, and some resources that we thought might be relevant to you. So let's kick it off here. So we work for the Department of Developmental Services. This is a state department that oversees services and supports for now 494,000 Californians who have either a qualifying developmental disability or they may be an infant or toddler with a developmental delay. And our program is really founded on the Lanterman Act. So our supports and services are defined in California statute. And the Lanterman Act was a landmark piece of legislation that established a statewide entitlement program to community-based services for people with intellectual and developmental disabilities across the lifespan. Now, when this passed in the 1960s, it was authored by Assembly Member Frank D. Lanterman, and it really established that California takes responsibility to provide services and supports and uphold the rights of people with developmental disabilities to make sure that they can live the lives that they choose in the communities of their choosing. And so our Lanterman Act not only set up this entitlement to services and the system that I'm going to describe to you with our regional centers. But it really set California apart from all of the other states. We're actually the only state still to this day that has an entitlement for services for people with disabilities of all ages. And so our program is very large in scope, very robust in terms of the services that we offer, and it is unlike anything else in the country. And we're very proud of that. There is a link here on the slide. You can read more about the Lanterman Act. We have actually the entire Lanterman Act as a PDF that you could read through if you really like to read statute. But there's also a document, it's called a Consumer's Guide to the Lanterman Act, that's a little bit more plain language that talks about what the Lanterman Act does and what people's rights are under the Lanterman Act. And I've read that one myself many times. And so if you're interested in reading more about the Lanterman Act, you can do that at the link here. So the Lanterman Act passed, and prior to the Lanterman Act, we actually didn't have regional centers. So once this foundational act was signed into law, it actually set up a system with what we call regional centers, and then it organized the way that services would be provided by those regional centers. And I have a bird's eye view for you of how the law lays out our system. And so in the top left here, this is the state government side. So we have our department, DDS, which is part of the California Health and Human Services Agency under the governor's office or the governor's executive branch. Our department, we do have some state-operated services, meaning we actually have state employees providing direct care to some individuals, but those programs are relatively small compared to what the regional centers do. So the bulk of our system is actually through contracts with 21 regional centers across the state. Now, the map at the far right shows you where each of the 21 regional centers are. All of them are made up of county boundaries. In most cases, one regional center serves multiple counties, with the exception of what is probably your local regional center, the Regional Center of Orange County, which only serves Orange County. And then in Los Angeles is one county, but there are 7 regional centers inside Los Angeles County. We contract with those 21 regional centers that are actually independent nonprofit agencies. So they're their own centers, their own separate independent nonprofits. They have their own board that governs them. And then each regional center provides local case management to individuals with developmental disabilities. So each person served by a regional center gets a case manager, or sometimes called a service coordinator. And then the regional center also vendors with service providers. So they find community-based organizations and businesses, and they pay them to provide direct services to those individuals on their caseloads. So this is sort of the overview of our entire system. And I'll tell you a little bit more about our programs within the system in a couple slides. All right. This is a look at our department's vision. And our department's vision is for people with intellectual and developmental disabilities experience respect for their culture and language preferences, their choices, beliefs, values, needs, and goals from a person-centered service system made up of a network of community agencies, those regional centers, that provide high-quality, outcome-based, and equitable services. So our vision and our guiding principles are really around upholding individuals' rights, treating people with respect, and really striving to provide services that are person-centered, that are based on an individual's choices and goals, their dreams for the future, and making sure that they have adequate access to services that really fit with their culture and their language. And these principles are designed to create a more responsive, respectful, and effective system. And this is what guides the work that we do every day. All right. So under our system, we have three main programs of services. So there's three ways you can qualify to participate. Um, our our smallest program by age is Early Start. This is for children from birth until their third birthday, so infants and toddlers under the age of 3. And it's our federal program for early intervention services. We also have provisional Lanterman services for children with
I
disabilities
allotted yours
under
today
their
that was
fifth
number one.
birthday.
Oh, okay.
And then you'll notice the largest green arrow here across all ages is what we call Lanterman services, named after Frank D. Lanterman. And this is a program for individuals who have qualifying developmental disabilities, which includes autism, as well as intellectual disability, cerebral palsy, epilepsy, and then other developmental disabilities similar to intellectual disability or what might require similar treatment. Individuals have to have acquired their disability before their 18th birthday. Now, that doesn't mean they have to be diagnosed before their 18th birthday. It just has to be a disability that was um, present in childhood. It is expected to be lifelong, and an individual has to have what we call a substantial disability, which means somebody has functional limitations in their daily living. So we do have some individuals who may have a diagnosis of autism, but they might not meet the substantial disability piece of the qualifications for services. We see that sometimes happens. So not necessarily everyone with a diagnosis of autism might qualify for regional center services. Um, but these are our three main programs. Most of our individuals are served under Lanterman, of course, because there are a lot more ages across the lifespan that count. Um, okay, there are some other services that are provided in the state for people with disabilities. So our local education agencies provide some early intervention services, particularly for uh, infants and toddlers that have low incidence disabilities. So deaf plus children or children who have visual impairment or who might be blind. Our education agencies also provide special education services and general education services until the age of 22. Many individuals may also receive services from the Department of Rehab or Department of Rehabilitation. And then as we get into the older ages, our community-based adult services may kick in. And we are going to share with you a couple of the resources through some of our sister agencies later in the presentation. Okay, so I'm going to walk you through a little bit of our data, not too much. This graph is showing you our entire caseload. So everyone served by a regional center, spread across the age ranges. In yellow at the far left here, these are individuals in early start, so our infants and toddlers. We have about 62,000 children served through early start. Provisional is the kind of medium blue color. There's a little sliver above 2 there. Most of them are in this 3 to 5 group. We have about 9,000 served in provisional Lanterman services, and then 370,000 individuals in Lanterman, which is the red bars, and they span across all of the age ranges here. So this is a look at everybody we serve. And again, we're up to about 490 something thousand as of today. Now, if we zero in on autism, this is our autism caseload. We have a total of 196,756 individuals with a diagnosis of autism served by regional centers statewide. And looking across our ages, we have about 78.5% are currently under the age of 22 years. So the majority of individuals, autistic individuals served by regional centers are currently children. And this uh, age trend that we see here, where the bulk of the individuals are at the younger ages, is really unique to autism. We don't really see a spread quite like this for intellectual disability or our other categories. So that's a unique trend that we see with autism. The largest share by our subgroups of ages is actually children 6 to 9. So you'll notice that's the tallest bar here. 22.5% or around 1 in 5 are currently 6 to 9 years of age. So we've been seeing more recently many children and youth newly entering our system with a diagnosis of autism. But when we look at the speed or change in our system, we're seeing really rapid growth in that 22 to 31 group. So our young adults, that group has almost tripled actually over the last 10 years. So that group is growing really, really quickly. And over time, as we see individuals in our system, each year they have a birthday, they get a little bit older. We'll see these bars sort of marching to the right. We're going to see more and more young adults um, that will be serving with some of the programs that we're going to share today. Um, I'll also note we do have a ratio of 3.6 to 1 males to females. So we do have more boys and men on the spectrum than we do girls and women in our system. And that's pretty similar to national trends. More males tend to be identified with autism than girls currently. Okay, so let me go back. So this is a look at our data, our recent data. And what we've noticed, we've seen year over year very consistent growth in the autism caseload. And actually, over the last 10 years, our autism caseload has more than doubled, which is really strong growth. We don't see that pretty commonly in our system. And so recently we've been seeing really rapid growth. It's continuing each year. Um, and because of that, um, our department and the state thought the opportunity is now to put more focus on autism and start to really think about our service system in the context of this changing population. If we have more children on the spectrum, we're going to have more adults on the spectrum. And are we making sure that our system is prepared to serve all of those individuals and really have services that are responsive to their needs? So that brings us to our Autism Services Branch. We're actually one of the newest branches at DDS. We formed in July of 2023, and that's when we started hiring our team. And our branch was really established to take a look at our population of individuals on the spectrum and to really start building statewide services and supports that meet the unique needs of autistic people, and to also make sure that we have system-wide capacity and expertise to effectively meet the needs of our changing system. And so our branch was developed. We've started working in a number of areas, and we're going to walk you through each of the things that we do. Um, One of the things that we are focused on, of course, is research and data. Like I mentioned, I'm kind of a data nerd. I always bring data into every presentation because I love it, and I think it can serve a purpose to help us develop effective programs and services. It's of course not all of the story, and Monica's going to tell you more about our community efforts as well. Um, but research and data is one of the things that we do. So we track our caseload, we're looking at trends, We're researching, are there innovative programs or models that we could implement or replicate? And then one of the things we're also responsible for is reporting to the legislature every year. So each year on April 1st, we have to give them a report to show them what the data look like, what the demographics and characteristics are of the population we serve, and then also the activities of the branch. We actually have that report published on our website. So if you go on the website today, we'll give you the link, I think in a couple slides from now. You can actually read last year's report. The 2024 report is up very soon, probably in the next or mid-March. So in the first couple weeks of April, the 2025 report should be released. So if you can remember to hold off until April, our brand new report will be published. Okay, so I don't see any questions yet, so we'll keep going. And I'm going to have Monica tell you a little bit more about what our branch does.
Oh, the autism.
Monica, we're not
Monica,
able
we
to
lost
hear
your
you.
audio.
Monica, we're not hearing you.
Still no.
Try again. No, we're not. It's not coming out of your microphone.
We heard you briefly and then it cut out.
We'll give her a second. Yeah, you're good. We can hear you.
Sorry about that. Thank you
No
for
problem.
your
Thank you.
patience. Okay, so let me get to where I was. So the Autism Services Branch is committed to ongoing community engagement. So you will see us actively connecting with ASD communities through targeted meetings and events. And in these pictures, you'll see some examples of our team at community resource fairs. So this is where we connect with autistic individuals, neurodivergent individuals and their families, and try to address their questions and concerns. And we really do prioritize amplifying the voices of individuals with that lived experiences, really leveraging their insights to help us shape our work and guide us in the direction of improving services and supports throughout the state. As a part of our community engagement, we are investing our time in ongoing autism focus groups, which is comprised of autistic regional center served individuals aging about ages 18 to 49 from across California. And so the primary function of this work group is to identify priority areas for evaluation and to make recommendations on how to reduce barriers to community inclusion. This group began meeting quarterly in 2023, and it will continue to meet throughout 2025. In 2024, the DDS Autism Services and the Safety Net branches partnered to host 2 family focus groups in Northern California. So this group brings together families of children and youth with developmental disabilities and high support needs, or who experience behavioral complexities or crises. And these meetings were actually initially inspired by a parent advocate who brought to the attention of the department barriers she faced trying to access services for her autistic son who had high support needs. And so these meetings center again on families' lived experiences and leans into identifying potential focus areas for service development and system improvement. And this year, DDS will host additional family focus groups for this population in Central, Southern, Coastal, and far Northern California. Would also like to bring to your attention that DDS is planning to host focus groups with the LGBTQIA+ population. And we know that there is quite amount of a high overlap with the neurodivergent community. And we want to gain more insight into their experiences and understand how we can support better access to services and care. So we also, next slide, please. We also have our programs and services. And so one of our goals is to collaborate with systems partners to create high quality, equitable, and effective programs and services. So we work with public service agencies, universities, and community-based organizations to create programming to enhance the workforce. We do have an ongoing collaboration with the UC Davis Mind Institute called Echo Autism. And this program builds this interdisciplinary learning network across California to train individuals on evidence-based practices through presentations and case-based discussion. So the UC Davis Mind Institute, the USED, and the Autism Services Branch staff collaborate to identify topics and curriculum for 6 session trainings. And this cohort is free of charge and it's open to a wide audience. So medical professionals, education staff, mental health professionals, social workers, regional center staff, individuals with disabilities, as well as their family members. And there are 2 to 4 different training cohorts, depending on each topic, which are held each year. And some previous topics that have been covered are behavior supports in medical settings. There is Eco Autismo, which is offered in the Spanish language, early intervention strategies, and creating inclusive medical settings. There is a new training cohort starting April 10th, and this session will be focused on community perspectives and neurodiversity. So you can sign up using the QR code on the slide or the link in the slide deck. And don't worry, if you miss the spring cohort, there will be another cohort starting again in the early fall. We also focus on advising on strategies and policies and legislation that best serve individuals on the autism spectrum. Some key focus areas to date have been early identification of autism for access to intervention, post-secondary education and employment transitions, as well as services for adults as they age.
We do have a couple questions in the chat that I wanted to get to. Since we're still on the Echo slide, we did get a question, what is the ultimate goal of Echo? So Project Echo itself is a model that was developed out of the University of New Mexico to create virtual learning communities to build special expertise primarily for clinical practitioners like doctors, psychiatrists. The Echo Autism that we are hosting in collaboration with UC Davis is a little bit more broad in its scope. So it's really about enhancing community expertise, and it's really focused on autism and neurodiversity. Now we've broken it up into these different topic areas, and some of them do lean a little bit more towards certain specialties. So like the behavior supports in medical settings, primarily was medical practitioners, nurses, hospital administrators who showed up. Whereas when we did the early intervention topic, we had a really broad array. So regional center staff, social services staff, and social workers came. We saw individuals from the mental health field, and we actually had quite a few families and autistic individuals come to learn as well. So really the broad goal is to increase people's knowledge and awareness around autism and neurodiversity and how it applies to making our communities more inclusive and places where people belong and where community members feel capable and willing to serve. There was another question about the previous slide. Why is the family focus group only for young children, such a need for young adults? Yeah, so we focused this series on families supporting children and youth Under 22, I think, is our cutoff. The reason for that primarily was because the end of 2022 and going into 2023, we had just finished a series of listening sessions around our safety net continuum, which is similarly focused on individuals who may experience acute crisis, behavioral health challenges, or mental health challenges. And that one was really broad. And what we found was most of our family participants and individuals participating were caring for adults or were adults themselves. And so we felt like there was a gap where we didn't hear very much from the families who were supporting children. And we really wanted to hear their perspectives on primarily prevention. Are there services and supports that we could be pushing in earlier to better support families? How could we make our systems like regional centers and school systems, collaborate better to support children? That was primarily why this one in particular is focused on that age range. But I fully agree, our young adults, even our middle-aged adults and older adults, we're starting to see some real complexities and often higher support needs. And that's definitely a gap that we're still trying to fill for sure. And then there's another question about serving as a resource for someone with dual diagnosis. I won't read the whole comment. But we absolutely can serve as a resource. We'll tell you a little bit more about some of the ways that we do that. But we would also really love, after this presentation, if you want to connect with us, if you're experiencing challenges or you just have questions, you can always reach out to us, and we would be happy to be a resource. Oh, okay. Working full time. Is there a weekend session? So far, we haven't done weekend sessions. They've been doing them mostly Thursdays around lunchtime, because a lot of people were saying it was easier to make it during a lunch break. But that is something that we could talk to UC Davis about, or potentially run a survey to see when people might be most available for the next session. We will have a cohort starting in the fall or evening ones. Okay. I'll definitely make a note of that. Thank you. Okay.
And thank you for your questions. And I'm sorry I don't have my chat feature open. So thank you, Dr. Libero, for stopping me. So I want to talk a little bit more about our information and training operations. So this branch also offers accessible educational sessions, practical resources, tools, and strategies for and in collaboration with our partners. And we really focus on coordinating person-centered trainings on ASD. Again, informed by that lived experience and also supported through evidence-based practice and research. In 2025,
Follow through.
have and we will be providing trainings to universities, statewide regional center staff, DDS staff, nonprofits, professional organizations, and a variety of other systems partners. We will be working closely with CSUs and UCs to provide educational trainings on the developmental service system and regional specific resources, hoping to bridge the gap and bring more people into clinical services to support this growing population. And we also develop informational resources, toolkits, and handouts and guides. And so an example of this is we are collaborating currently with regional centers to develop an updated best practices guidelines for screening and diagnosing autism. And we recently launched the Autism Resource Hub on our DDS website. And on the Resource Hub, which is linked here, you can look at information, data, links, and resources related to autism, developmental disabilities, and other helpful resources for individuals, caregivers, and professionals. Our team reviews and develops new resources, which are added to the website on an ongoing basis. So go ahead and check it out. I'm sure you will find something useful there.
And also just a quick plug. We do listen to the community. So if you take a look at our website and there are other resources that you think we might be missing, or there are toolkits or handouts that you think would be really, really useful to have to share with families, please let us know. Send us an email, give me a call, tell me your ideas, because we really are open to creating what the community wants to see. And, I'll be the first to admit I don't always know what people want until they tell me. So if you go on there and you're like, God, it would be great to have like a one pager on this topic, or I wish that you could link to this, like, let us know. We are constantly taking a look at it and trying to improve. So we really love to hear your ideas if you have any.
Absolutely. And if you are interested in reaching out to us, we have our communications and technical assistance support. So we have our autism helpline. So you'll see the number there, 833-815-2337. And we also have our email at autism@dds.ca.gov. And so anyone can call or email with questions or concerns related to autism, services, and resources. Please note this is not a 24/7 crisis line, and it is operational during weekday business hours. Again, if there is a health or safety emergency, dial 911, or if there is a mental or behavioral health crisis, dial or text 988. So the primary function of our helpline is to deliver that technical assistance for individuals, families, professionals, and organizations about anything related to autism, how to access public resources, and we aim to help address complex cases to support quality and continuity of service delivery. Our team can also direct you to regional specific organizations like state-funded family support agencies and local community navigator programs, which I'll talk about a little bit later.
And also, we had a comment in the chat, and I just wanted to mention our helpline is open to anyone. So you don't have to be a regional center served individual to email or call us. In fact, the majority of the calls we get are from people outside of our system inquiring. And so anyone can call or email with questions or looking for help, and we will do our best to answer, or if we don't have the answer, we will connect you to the person that does. So that was a really great question in the chat. Anyone, in fact, you wouldn't even have to necessarily be in California. I actually think we've had a few calls from outside of our state too. It is an open email account, open phone line. Anyone can reach out. Okay, so I think we're back to me now. Okay, so we've talked about the branch a bit. We wanted to share with you some of our more recent initiatives and some of the programs that DDS and regional centers offer. And some of my favorite services in our initiatives are centered around employment or work services. We have quite a few that fall under this category. I think one of the more commonly used employment services is supported employment, but we actually have quite a few different ways that people could explore whether working is something for them, to try to learn the skills that they need for the job that they really want to have. And ways to support individuals in learning to do that job, maintaining that job, and ultimately becoming independent in a competitive paid employment. So supported employment, this is where typically you would have a job coach who's working with you to find a job, shadow you in the job, teach you how to do the job, and then usually they fade out. Another service that we have is the paid internship program. Judy mentioned that one. I think this one also might be my favorite. The paid internship program. Um, it's for individuals to explore careers, um, serve in paid internships, up to 1,040 hours per year per internship. So individuals can do more than one. And it's really to discover and experience new employment opportunities. So if you're not quite sure what you want to do, or maybe you've never had a job before, this is a really great way to kind of get your feet wet, try out a job and see if it's for you. Um, it can also open doors to businesses that might have jobs where they've never hired someone with a disability before. It's a really great bridge for that employer to have a paid employee with a disability and learn how to support someone in that job and really create those community connections. I'll also note micro enterprises are eligible for paid internship program. So for individuals who want to start their own business, this would be an opportunity to start that. Um, and typically the goal is that you do the internship and then maybe you get hired on as a permanent employee, but not necessarily, right? Some people do use this to explore and try different jobs until they find the one that fits. To qualify, you do have to be served by a regional center and you have to be at least 18 years old. Um, I saw someone messaged me how to access employment services and supports. So you would the first step would be to talk to your service coordinator, and talk about your employment goals. And then they can help you decide which one of these might be the best fit. We all come to the system with different skills and experiences. Some people may jump right into employment from education. Other people might try paid internship. Um, and then we have a few other options. So for people on self-directed services like self-determination, they might receive their employment supports through their self-determination. Um, Individuals may use tailored day services to get some work experience. And then we have coordinated career pathways that I'm going to talk about in a second. Let's see. Okay, we've got another question in the chat. My son is 17, graduating with a high school diploma, is starting community college. Well, that's exciting. Congratulations. He will not turn 18 until October, and I'm finding there's not a lot of options for an individual tailored program. Yeah, it seems like maybe he's falling into that age gap.
We had a really great organization that was offering services in Southern Orange County, the
Yeah.
Vista Career Academy, and they could not they made a decision to pull out, and there's things up in Northern Orange County, but there's not as much now in Southern Orange County.
Interesting. Yeah, I can think of a few ideas, but it may depend on what's in the local area or maybe getting creative um, with your regional center or potentially Department of Rehab. Um, hmm. I'll give that one a little bit more thought. We may have to get back to you.
If that might would asking a question like that, Lauren, would that be like an appropriate type of question that you might contact you offline
Oh
in
yeah.
that email, and that you might be able to help research some ideas for them?
Oh yeah, we do that every day.
Okay, so that's like good to know that,
Mm-hmm.
because we are often having people having questions, and it's good to know that there's some resources out there besides working directly with the regional center. And
Yeah.
also, I think it's really good that you're going through this litany of services because that often is a question that we have with our members is not really knowing what they should be asking for
Yeah.
from the regional center. So it's kind of like it's like going to In-N-Out Burger and they have a whole hidden menu. You
Mm-hmm.
get your fries animal style and all these things, but unless you happen to know about it, you don't know to ask. And,
Yeah.
and that's a pretty common experience for people working with our regional center is really not knowing
What the
what
options are.
what the options are.
Yeah.
And if you guys were to do a webinar and kind of say what's behind that magic door, I think that would be a really and the issue is also
Yeah.
that each regional center operates
A
differently.
little bit
So
differently.
Orange County tends to be they look at themselves as really trying to save money in that piggy bank versus spending it on their
Mm.
constituencies. And so that kind of also adds to the lack of visibility that we might have on what those services are that are available. So anyway, I wanted to thank you for doing this, and my asking that
Yeah.
question was kind of a way for our membership to know that sometimes when you have that kind of question, your organization might be a great place to go.
Oh, absolutely. And I mean, we will, all of the questions we've gotten today, like, are things that you could email us. So if you think of other things, tomorrow you're brushing your teeth and you're like, oh, I should have asked them this, like, do not be afraid to send us an email. We actually really enjoy, getting the questions and helping. So, don't be afraid to reach out to us. Um, Okay, where was I? Okay, so I'm going to share with you one of my favorite examples of the paid internship program, and then I'm going to touch on the coordinated career pathways, which I'm also really excited about. So, paid internship, like I mentioned, can be related to trying out new job experiences, building your resume. Um, and one of the ways that paid internship was used actually last year um, was to create the Home and Community-Based Services, or HCBS, final rule animations. And the link to the animations and the behind the scenes is here on the slide. But this was a series of animated videos that explain the federal final rule for HCBS services. And they did that by hiring voice actors and animators with disabilities and paying them through the paid internship program. So these really incredible voice actors sort of breathed life into the animations. And they were able to do that with this program, which I think is really, really cool, because it resulted in this set of resources that a ton of people have been able to watch and learn from. And they were also, the actors were able to get that experience and another thing to put on their resume. So this is just one example, but the paid internship program can be used in, like, I mean, infinite ways depending on what your goals are or what types of jobs you might be interested in. Okay. And then coordinated career pathways. This is a newer service, probably our most new in terms of our employment services. This actually started for individuals transitioning out of our work activity programs, which were those segregated, like workshop type job sites, for, individuals who earned sub minimum wage. But it also includes people within 2 years of exiting high school. And that's at least for now. We get questions about if this will expand in the future. Right now, we're in the very first iteration of starting this service, so it's limited to those three groups. But this is a service that includes two pieces to it. There's the Career Pathway Navigator. This is someone who helps an individual and their family really work through the career planning process. So it might be identifying What are the career goals and what are the steps to meet those career goals, right? So it might be I want a career in a certain field, but I actually need to take some classes first, or maybe I need to job shadow a little bit. It's working out. How do we get there? And that could include things like how do I build a resume? How do I prepare for interviews? They may help with that. And then the other piece is the customized employment specialist, and they help the person directly secure the job that's customized for them. So, one of the criticisms that we've had with some of the work services programs in the past is that people tend to get funneled into really similar jobs that those supported employment agencies were really connected to or good at placing people into, and maybe weren't the most personalized. And I think when we're talking about autistic or potential autistic employees, we know that there's a ton of diversity and a lot of really interesting skills and talents that could be utilized for work. And so I'm really excited about this program in particular because it's really, by definition, meant to be customized for an individual's talents, their skills, their interests, and really finding that match um, for them to work. The service is time limited, so it's 18 months. It can be extended to 2 years. Um, and the link here has more information. You can read the frequently asked questions. But like I mentioned, this one is newer, so um, it has just gotten off the ground in this past year. Okay, there was one question. Are these services through Department of Rehab? The ones that I'm talking about here are through the regional center. But there are some services with Department of Rehab, or in combination, Department of Rehab and Regional Center. So, like one example of that is our state internship program, where people served by Regional Center and Department of Rehab can actually do an internship at a state agency like DDS. For that one, you would have to be registered with both departments to participate. For something like coordinated career pathways, paid internship, that would be regional center side. And then Department of Rehab also has supported employment type programs where you don't have to be a regional center client to participate.
Um,
So go ahead, Judy.
just a quick question on coordinated career pathways. Is that through vendors or is that directly delivered by regional center employees?
It's vendored, so
Okay.
there would be the career pathways navigator and the customized employment specialist would be a vendor.
Okay.
Yeah. Okay. I feel like maybe I've lost track of these questions.
No,
Have
you're
I
fine.
missed?
You're
Okay.
fine.
I was like, have I
I
missed
think you're
any?
good.
Let's see. Okay. All right. And then we also have a new employment webpage if you haven't seen it before. There is a lot more information. I feel like I've only scratched the surface about a couple of our work related initiatives, but if you want to read more about what we have to offer, you can click on this link. And it goes through all of the different options from this slide. So there's more information about supported employment, paid internship, tailored day services, coordinated career pathways, and there's some frequently asked questions on that website as well. Okay. Semi-related, we also have some workforce initiatives. Now, these are like really similar sounding because I just talked about employment. Workforce tends to refer to the staff who provide services in our system. Sometimes we call them direct service professionals, direct support professionals, or DSPs. But I wanted to mention these um, because one, it is important to build a qualified workforce. But I also think that this could be a potential career path for individuals with disabilities themselves. and potential ways to open up entry-level training and work experience. So the Direct Service Professional Internship Program. This is actually for people who have like never worked in the field before, but might be interested. And it's a way to receive on-the-job training to start learning if this is a career for you. It's about 3 months where you actually get paid while you're being trained, up to 30 hours a week. On the right side of the slide, this is a picture of our flyer. The QR code will take you to the page that has like more information and the sign up. You can also email the DSP interns email account that's on here if you have questions about enrolling. For DSP internship, you have to be 18 years or older, have a high school diploma, GED, or certificate of completion, and have an ID, not necessarily a driver's license, just a state ID, and able to pass a background check. There isn't a disability requirement, so you don't have to be regional center served. You could be anyone actually and participate in this program. And they are enrolling now. So if that's something you're interested in, you could actually get started very soon. And then the other direct service professional related initiative that is coming soon is our Direct Service Professional University, or DSP University. This is going to be a 3-tiered training program for people in our system to build more competencies. There's going to be certification involved, and it's really to enhance training for people working in this field. And then there's going to be associated wage increases. So the people who go through the DSP University and they're learning more about disabilities and how to support people, they'll get a wage increase as a result of completing those 3 tiers of training. Now, this has not launched yet. It's probably coming later this year. So you can keep an eye out for that. But someone could potentially go through the DSP internship program, and if they decided this was their career, later this year or next year, they could enroll in DSP University and start building their skills even more.
So is DSP University open to the public, or is it just for government employees, or is it just for the regional center served people? Who are the potential students for DSP University?
Yeah, that's a great question. So it's initially meant for like regional center vendor staff. So vendors would enroll, and then if you were working for a regional center vendor, you could go through DSP University and get the wage differential. But we're building it with the CSU system, Sacramento State. And we've been talking with some of the community colleges about whether this could become a certificate program for people not associated with a regional center vendor. So I think the sort of initial rollout will be focused on people who want to work in our regional center system. Um, but I think it'll
Yeah.
evolve to do more.
In terms of that, just FYI,
Yeah.
job coaching is a real problem area in terms of having enough job coaches. So if you were to focus in on that
Okay.
and offer that as a certificate with the regional centers, I think that would serve a lot of the communities well.
Okay. I'm writing that down. Okay. Martin sharing his experience. I love that. Okay. I'm going to keep us rolling here. Coordinated family supports. This was another recent, I say recent, in the last few years. This was a newer service option for adults 18 years and older who choose to or currently live in their family home. And this was really to fill the gap for individuals who didn't want to move out into independent living or supported living or a group home, or maybe were not prepared to do that yet. So they can stay in their family home. but start learning the skills for independent living, accessing the community, and it offers coordination to connect people to services outside the regional center system too. So if they needed assistance accessing medical services or mental health services, this program encapsulates all of that. There's the link here that can tell you more about this specific service, but it is for individuals to continue living with their families. All right, self-directed services. I did touch on before when I mentioned the employment services. Self-directed is one of the ways you can access that. But this refers broadly to services that give individuals and families more freedom and control in choosing their services. They get to pick who they hire, when to schedule them. They have more supervision. And typically, this is done in collaboration with a financial management service that pays for the staff that get hired for these services. Now, there's two pathways that are considered self-directed. The first one is participant-directed services, and this is for specific types of services like respite, personal assistance, supported employment. But it allows individuals or families to choose who they might want to hire. They can schedule when the people work or how many hours they work. And really key, they can pick providers that match their culture and language, which we've seen as a gap with some of our vendors. The other option under self-directed services is self-determination. This is a program where enrollees get to decide how their funds are spent. And so in comparison to our traditional services where you have a service coordinator and you meet with them and you come up with your plan, and then that service coordinator figures out, okay, here's the vendor and you're going to go see them. And let me connect that. In self-determination, you get to decide, okay, well, I want to go to this service in my community. They may or may not currently be vendored with a regional center, so there's a lot more flexibility in what you can access. And you can locate and hire providers or staff for specific services that may not be available through the traditional regional center vendors. So in this program, you get a lot more flexibility, but you also have a lot more responsibility over the programming decisions. And so for some people, this is a really great fit. For other people, it may be a little bit more work or may not actually meet their needs. Okay. Really quickly on service access and equity, this is an initiative we've run for many years. The biggest portion of this program is our service access and equity grants program. This is an annual $11 million that the department disperses to community-based organizations and regional centers for grants to improve access to services in our system for different diverse communities or regions of the state. So on our website, you can actually go and look at all of the funded programs. So you could go and see like which programs or grants has gone to the Orange County area or across LA. But they varied year by year. The cycle, we have a new set of grantees every single year. And the programs have really spanned like early start all the way up to aging adults, language-based communities, cultural communities, certain ethnicities. It might be related to screening and getting access to regional center services. It might be training self-advocates in their rights. It could be parent trainings. I've seen a huge wide array of programs here. So that's really the heart of this initiative. But there's a few other things we do through service access and equity. We have language access and cultural competency. Plans, the regional centers have to come up with plans to improve access to individuals from different languages and making sure services are culturally competent. So they receive funding for that. We also have community navigators that Monica will mention a little later. We have started engagement with the different tribes in California who have historically really been under-resourced and under-identified for supports and services. And then we have a few others. Okay, how are we doing on time? You doing okay?
It's 8:12. We're set to go till 9 if you guys can last that long. So there's time, I
Okay, so we
think,
still got time.
for
Okay.
for questions at the end. Yeah.
Okay, good. Okay. So a few of our newer initiatives or initiatives sort of in progress. One of them is the new individual program plan or IPP template. This actually started use January of this year. So just 2 months ago, this rolled out across all of the regional centers. It was developed with feedback from individuals and families, different advocates, our system partners, and it's a standardized template. So each regional center is using the same sort of base for an IPP. It includes an individual's strengths, talents, their dreams and goals. And so I really like that that is now really central to the IPP. In addition to the actual template itself that was given out to the regional centers, the department has also developed quite a few resources to support using the new IPP template. So there's a video series, an animated series that explains why we move towards this new style of IPP, how to use person-centered practices and how do you apply those to your plan. And then we also have guides about the IPP. So the one for individuals is called Your Plan. There's also a version for children and youth called Your Child's Plan. And those actually guide you through how do you prepare for an IPP meeting? What are the questions you might want to ask? Who are the people you might want to include? What are your strengths? What are the things you might need to work on? And then what are your goals for the future? And so that is really a guide. There's like worksheets in there. Those are available on our website. And one of the things that's also newer about this template is it really looks at an individual and family's short and long-term goals. And I think before there was a lot of emphasis on, okay, well, what are we doing for the next year or maybe the next 3 years? Whereas the IPP template is really like, let's look at some of those long-term goals too. Where might you want to be in 5 years or 10 years? And around the time that the department started developing this, the state also passed Assembly Bill 3291. I'm not going to get into like the legal speak of that, but one of the requirements was that the regional centers' individual program plans actually discuss what it calls caregiver succession, but it's really those long-term care plans for individuals who might be living in their family home and have aging caregivers. You know, what is the plan? What are they going to do over the next 10 or 20 years and how will they live? And so I think those together have really put more of a focus on that long-term planning, which is so important for us to meet our goals and make sure that we're being supported over time. Okay, what else is new? Okay, our provider directory. This is currently under development. So right now you can find a little bit of information on our website, but not a whole lot. The provider directory is the ultimate goal is to have individuals and families be able to access like a central hub that gives you all of the provider information in the system. So it'll make it easier for you to find not only that like menu of services, but who in my area might be providing those services. You'll be able to literally look it up in this directory. It'll be one central online portal where anyone can log in and do a search. It's being developed in phases. So right now, the regional centers and the service providers or vendors are inputting the information and testing and validating it to make sure we have all of the right information in there. The next step or the future phase is going to be launching this so that individuals and families and the general public can access it. So I'm not sure the exact timeline of this, but this is going to be coming within, I think, the next year. And it'll provide you that list where you could literally look up some of the answers to the questions today, actually, who in my area might provide a specific service. Okay, the master plan for developmental services, this has been getting a lot of press. This is meant to be a statewide plan to really strengthen the developmental services for people with disabilities across systems. So not just DDS, but also access to education, housing, employment, transportation. This plan initially began being developed by a committee that was appointed by our California Health and Human Services Secretary. And then we established 5 work groups with additional members to talk about specific aspects of the plan. And the plan is supposed to be delivered, this says March. Actually, there is a draft of the plan now posted on the website on the link here. So you can actually read the draft right now. And Wednesday of this week is the last master plan meeting. So if you had any last minute feedback, Wednesday is your last opportunity. I believe it starts at 9 a.m. The registration link is also at the master plan website that's on this slide. So you can, if you wanted to listen into the discussion or you wanted to give feedback, that's going to be the last opportunity. And they are anticipating that this plan is going to be finalized and published on the 28th, which is next Friday. So this is coming very soon. This is a really big undertaking. It really establishes quite a number of recommendations for improving our service system across systems, really, for people with developmental disabilities. So this is coming very soon in the next few weeks.
Okay, so for the next several slides, just want to direct you to some other resources that might be useful. So DDS does have a wellness toolkit on its website, and it provides information and tools related to health and safety for individuals, direct support professionals, vendors, and providers. So you'll find a variety of handouts and videos on topics ranging from stress management, managing high blood pressure, dental care, drowning prevention, and more. So go ahead and check out that link when you have some time to peruse. And I also wanted to direct you to our family resource centers, the FRCNCAs of California. Next slide, please. And this is a coalition of 47 organizations in 58 counties across the state, committed to improving the lives of families with children and loved ones who have disabilities, special health care needs, or are at risk. And so these centers offer parent to parent support, so that practical guidance and mentorship, really trying to reduce isolation that parents feel in this space. Also, they offer coaching and mentoring, so for both parents and professionals. They offer strategies for managing and improving skills. And they also connect families with educational materials, other support groups, and some financial assistance programs. Again, there's professional development, and they also help with access and advocacy. So they help families understand their rights, how to access services, and advocate for their children within the developmental service system. This truly aims to empower families to advocate for their children's needs and to also work at the state and local levels to develop those really important policies and programs. And within this, we also have community navigator programs, which are funded through DDS. And so these programs, again, work with individuals and families to support access and utilization of regional center as well as generic resources. So you can learn more about the Family Resource Centers at the link at the bottom of this slide. Next slide, please. And so your local family resource center is the Comfort Connection Family Resource Center, which is a state-funded agency, and it provides a variety of services and supports at low to no cost. And this includes, but is not limited to, peer support groups, mentoring, recreational activities, webinars, one-on-one consultations, and they also do, again, provide a variety of educational resources that you may need. Next slide, please. I also want to orient you to some more state resources. So we have the California Department of Aging, and they help administer programs that support older adults, adults with disabilities, family caregivers, and residents in long-term care facilities across the state. There's also the Department of Healthcare Services, which provides a range of healthcare programs and services for individuals as well as partners. And this includes Medi-Cal, which is California's Medicaid program. And they offer healthcare services for low-income individuals and people with disabilities. And they also support with enrollment through Medi-Cal Dental. Um, we also have the California Department of Public Health, who we work closely with. And there's also CalAble, and this is a really interesting program. And this enables individuals with disabilities to save and invest money in tax-advantaged accounts without affecting eligibility for public benefits like Medi-Cal or Supplemental Security Income, SSI. And funds can be used for qualifying disability expenses, including education, housing, and transportation. We also have the California Department of Rehabilitation, which I'm sure many of you are familiar with. And DOR, again, collaborates with individuals and other partners to provide services, advocacy, help promote employment, independent living, and equal opportunities for individuals with disabilities. And we also have the California Department of Social Services, and they also offer a variety of resources, including child welfare programs, financial assistance, food and child care service programs, and they have several other state programs for individuals of all ages. So make sure you spend some time looking at other state resources that are available to you. Next slide, please. We also wanted to let you know about two very special programs. So, through a partnership with the California Utilities, Public Utilities Commissions, and Deaf and Disabled Telecommunications Program, and DOR, they have a voice options program which provides eligible Californians who are unable to speak or who have difficulty speaking with a free speech generating device. And again, a free SGD. And so through this program, an eligible Californian referred to a voice options provider has the opportunity to test 6 different speech generating applications for up to 14 days. And once this trial period has ended, the user exchanges the borrowed iPad with the communication application for a new one that is loaded and ready to go and theirs to use. And through California Connect, you can receive specialized phone equipment if you have a qualifying hearing, vision, cognitive, mobility, and or speech-related disability. So we encourage you to tap into this resource if you are eligible. Next slide, please. So we also have California Health and Human Services Agency has been developing a wealth of mental health and behavioral health focused resources. And the Children and Youth Behavioral Health Initiative has created free resources and toolkits and apps for mental health and well-being for individuals ranging from ages 0 to 25. And this includes Bright Life Kids and the Soluna apps, which are free apps for children, youth, and families to access live coaching, interactive games, and tools to learn some coping skills, and it offers some peer support. This initiative has recently launched its free mirror journaling app, which provides access for guided self-reflection and mood check-ins. The apps are easy to navigate, and so we encourage you to check them out and share them with your networks. The initiative's webpage also has links to other parent and youth resources and tools that you might be interested in. Next slide, please. Another resource out of this initiative is the Never a Bother campaign. And so this is a youth campaign. So again, ages 0 to 25 for suicide prevention. And the ultimate goal is to increase awareness and support and resources among California's young people. The campaign was created with input from over 400 young people across diverse communities in California, in addition to their youth advisory board. And the resources include information about suicide warning signs, crisis lines, and sources of support for youth and young adults, their friends, and their caregivers. There are also some inspiring videos and helpful videos of youth, as well as some pop culture figures like Megan Thee Stallion, sharing their stories and messages of hope on the Never Bother YouTube and social media pages. So we again encourage you to check those out. We also want to orient you to the 988 crisis line, which is available 24/7 via phone, text, chat, or video chat for anyone who is experiencing a mental health crisis or a substance abuse or use crisis, or anyone who is supporting someone who's going through a crisis. Cal Hope also has a number of resources related to mental health, including their warm lines, chat, virtual support groups for individuals from various communities, and they again offer various mental health and wellness resources to meet a variety of needs. And I also want to orient you to our ombudsperson. So we have two offices. One is for the self-determination program. So the SDP ombudsperson has a primary focus of implementation of the self-determination program. And so they can help identify barriers, successes, and help facilitate solutions. This office works with all individuals and entities within the self-determination program. DDS also has a Lanterman ombudsperson whose primary responsibility is the implementation of the traditional service system. This office is autonomous and callers can remain anonymous if they wish. The ultimate role of the ombudsperson is to provide information and resources to individuals that contact our offices. And so we receive calls from individuals looking to apply for regional center services, individuals who are interested in the self-determination program, and regional center staff and community groups. This office is a resource. At times, individuals will call because they're having a difficult time coming into an agreement with the regional centers, and this could be due to a number of reasons. And the office will schedule a time to connect with you to get a better understanding of the situation and the disagreement and offer recommendations and information to move things forward. If there is a complaint, this office also tracks the nature of the complaint and the number of individuals this is impacting. Although the desired outcome may not be immediate, our office does aim to understand the barriers in service delivery. Keep in mind, this office does not decide disputes in favor of one party or another. They do not represent someone in a hearing. They do not make recommendations to a court or a hearing officer, and they also do not overturn a fair hearing final decision. And before we end our presentation, I wanted to remind you of our autism helpline. So again, if you or someone you know needs help accessing resources, navigating the regional center system, or have general questions related to autism, you can call or email us and we will get back to you within 48 to 72 hours. And also, if your organization is interested in a presentation, a training, or workshop, please do email us at autism@dds.ca.gov. We'll drop the email in the chat for you. And for our last slide, for general information about DDS, you can go to the website, or you can call or email at info@dds.ca.gov, or you can call 833-421-0061. And so I think now we will have a little bit of time for Q&A.
Well, thank you so much, Lauren and Monica. That was really great. And it was a lot of information. There's a few questions in the chat. I thought that, I think Ivan gave a question, which I think is a good little case story about he's moving out in a couple years, wants to know what resources there are to help him with the transition and either housing support or transition support. So you shared some transition support and we want to learn more about that. But I just wanted to mention, and I'm sure it's no surprise to you, the whole issue of housing is a huge, huge issue for this population.
Yeah.
I'm sure not just in Orange County, but other places as well. And we've had people from the housing people from Regional Center come, but again, there was a lot of services available, but it was very complicated. And it was hard to know what was what and how you apply for what and things like that. So I think Ivan's question is good. So if you could be sure and deal with both transition services, which I think you already kind of talked a little bit about, and then also if you guys are seeing that housing, affordable housing is of concern and what's going on there.
Yeah. So with regards to the transition, one of the best services for that is independent living services. So this is where you would learn to build up those living skills. So how do I cook? How do I clean? How do I do my laundry? All of those things we have to do as an adult is what you would learn, budgeting, how do you pay rent? All of those things would be what you would explore and start to learn, and then they would help you plan your transition. Supported living services is another option. This would be once you move into your home or your apartment, they would come in to help with anything that you might need extra support with in the home. So those are two highly used services for, training and supporting that transition, gaining more independence, and living, as independently as possible. Now, touching on your point about the housing shortage, of course, we see that impacts across the state with that. And probably more so, in your area around Orange County, Los Angeles, housing costs have been skyrocketing and the available housing pool seems to be shrinking. It's definitely something the department is tracking and working on. Um, One of the tools that we have is our Community Resource Development Plan, CRDP. Initially, this was actually called CPP, the Community Placement Plan, and it was actually a, a chunk of money that the department got initially to plan for individuals who moved from our developmental centers into the community. So historically, we had many individuals who lived in our state-run developmental centers. So people lived on the campus and state staff operated it. And then we slowly closed each developmental center and moved everyone into community living. And that plan was meant to transition people and develop homes for people who might have higher acuity needs or special housing needs. The fund was used for developing some of our specialized homes, like the enhanced behavioral support homes or the adult residential facilities for people with special healthcare needs. Anyway, long story short, we've closed the developmental centers, but we still have that pool of money to develop community-based resources. And what I've seen over the last few years is a transition towards developing more affordable housing projects. And so this looks like um, developing apartment buildings or um, collaborating with large housing developments. So if there's a developer who's building, 100 units of a new apartment building, setting aside 20 of those units to be low cost apartments for people with disabilities. And so we've funded some of those projects. We've had a few come online already. We have several more in the works, and I know that we're planning even more. Now, of course, the capacity, it's going to take a while for these to get rolling, but
And
that is,
how is that, Lauren,
yeah.
I asked another kind of related question
Mm.
just because I'm curious, but I want to kind of have it then go back to this. I think that's great, that program you're talking about. I'm wondering what is you shared some really great numbers of the cases of autism
Oh, yeah.
that, and I was wondering geographically where those folks located and these programming, you're doing great things in Sacramento, but we're down here in Orange County and we see it very common in Southern California. So we don't know what the distribution is. Is it like a peanut butter and it's everywhere the same? Or are there certain geographies where there's a higher incident of autism? And so some of these programs might need to be more focused based on the geographical distribution.
Yeah, so the program I was talking about with the affordable housing is statewide. So we've
Mm-hmm.
been trying to develop them everywhere. There's going to be a more concentration around like the Bay Area, Los Angeles, Southern California, just because of the population density. There's a lot more people living in those areas. Specific to autism, we do see some regional differences. Actually, I think the 2025 report is going to have a map that shows by
Uh-huh.
county where those distributions are. Um, the challenge is that age distribution, where most of the caseload is younger. And so in terms of like adults who might need housing who are also on the spectrum, it's a relatively smaller population right now. But we're going to see probably more density of the projects around where people are living.
And,
Um,
and that program that you're talking about, is that through a grant process? Is that being coordinated through the regional centers? So if you have a really energetic regional center, you might have more things happening versus if you have one that's not too engaged, you might have less. So how are those programs being driven?
so the funding it's state funding that's allocated to DDS, and then most of the funds then get pushed to regional centers for their projects. Each regional center has to give the department their development plan, And that has to be informed by their community. So typically we see regional centers will put out a survey or they might host community meetings to get feedback. But it may vary by regional center, and whether or not they're good about blasting that out. Um, and so I have actually seen a couple cases where the community was really, really loud with their regional center about a specific resource they wanted, and then the regional center put it in their plan, and then we funded it. So I have seen that happen.
And
Um,
Lauren, have you talked about being a data geek.
yeah.
Have you seen, there's been a lot of, there have been spatterings of very creative type of living situations for people on the spectrum throughout the United States or the
Yeah.
globe. And I was wondering if you guys have done any research on different types of living situations that might make sense for our community and that you've been able to look at in terms of coming up with alternate housing models.
Yeah, I mean, I think each person is an individual who might, live better in a different situation. Some people really like their own apartment with their own space. Some people really like to be in a building where they're, you know, socializing with a lot of others. And so the programming we hope is going to be, geared towards each individual. But I think what you're talking about is like um, the programs where it's like a farm and everybody lives on the farm and works
Mhm.
there, like
Yeah,
that kind of
different
thing.
kinds of things.
Yeah, we have a couple of those in the state. I know there's like one in Sonoma. There's another near, like closer to Santa Cruz. We have a couple like co-op type um, uh, sort of housing. I don't know if housing development is the right word, but it's sort of everyone lives on the property and um, we have a few of those. I've actually I've not seen a lot of growth. Like I'm not seeing a lot more of those pop up.
Okay.
And the ones that I am seeing tend to be funded by families that come together and kind of crowd fund it. I think the reason for that is because the federal funding rules around housing um, really preclude like segregated living
Yeah, I
situations.
see it.
Yeah.
So I've been kind of there's some good questions in the chat. So one Jonna asked, can you explain how participated directed service works, examples of services that are covered and how to apply for this? So
Oh.
that's as opposed
Hmm.
to, I guess, self-determination.
Yes,
Yeah.
yes.
Yeah, okay. So you could talk to your service coordinator to set this up. There are certain services that qualify for it and certain ones that don't. The one I see most often is respite, where an individual might want to hire, for example, a family member that works really well with the individual. Participant directed services could be used to choose that family member as the respite worker. And then the financial management service would essentially hire them and pay them. So that's kind of how it works. To set it up, I mean, the easiest way would be through your service coordinator. Um, but yeah,
Is there a special process for doing that, or do you have to, like, I know like if you want to use your own services, it's like a whole process to get either them vendored or you have to be a vendor so you can get reimbursed. Um, how does that work for this particular program?
yeah, there's a little bit of a process to it because we want to make sure the person providing the service, um, is safe and qualified. So there is a process where essentially they get like hired through the financial management service. If there's a background check, it would get submitted through them. and then that service would be the one that directly pays the person. So it's, I mean, there is a little bit of a process in terms of getting that set up. But you would be able to choose, who you wanted to be the respite worker or your personal assistant. I think there's a couple others that qualify for participant directed.
It said it supported employment is part of those
Mm.
services. So like a job coach.
Mm-hmm.
And you don't have to be part of, oh, sorry, I'll turn my video on so you can see me. You don't have to be part of self-determination
No.
to,
Okay.
okay. All right, thank you.
Yeah.
Thanks, Jana. There was a question from is it Eduardo?
Garda.
And it's kind of a similar question that you and I talked about offline, which is, are any of the services that you spoke about at risk because of some of the activity that's happening at a federal level right now related to budgeting and agency support and
Sure.
all
So,
that?
yeah. So our early start services are our federal early intervention programs. So we do get federal funding for that. And then generally our regional center services, sorry, I have a bar. Sorry, I have a puppy who's getting anxious. Okay, so our general regional center services, we do get federal reimbursement. So about 50% gets reimbursed through our waiver with the federal government. So now that being said, we have the Lanterman Act, which entitles people to services. So it's a little bit hard to answer the question if there were changes to federal funding pushed down through the current administration, what that would mean for our service system. In the beginning, if something changed with Medicaid or the HCBS program, the state of California would be responsible for picking up the tab to cover the services that people are entitled to. And so at this point, we don't quite know what that might look like. If we would be as a state in a financial position to just cover whatever might not be covered anymore by the federal government, or if that might be too big of a financial strain. We would have to see if something like that happened. Of course, I'm really hoping that none of our services get touched. But some of them are reimbursed by the feds.
Do you know, Lauren, the CARES Act, it was directed at services and funds for autism. It was originally signed, I think, in 2018, and it was just signed again in December. Does any of that funding come through DDS or that you're aware of?
The bulk of that is research directed. So it would go to agencies like the National Institutes of Health to do research related to treatments, biology, services. That's where almost all of that goes. So that wouldn't have an impact on us. Although some of the federal cuts we've been seeing to the NIH could potentially impact what was in the CARES Act. So, in other words, there could be impacts at the federal level related to research,
I see.
but it wouldn't impact California's services.
Okay. Are there any other questions for Monica and Lauren? Well, it's getting late in the day. I want to thank you again. This has just been really, really helpful. I would love to talk to you some more offline about a couple of things, but I don't want to take everybody down my little list. There's let's see, are we able to get your guys' contact information? I don't know about that. And Lisa says, thank you.
Yeah,
So,
if you think of other questions, or you want to give us feedback, or you think of ideas, for resources we should develop, you can email us at autism@dds.ca.gov. And if for some reason you wanted to talk to Monica or I specifically, if you just say that in your email or your phone call, they'll route it directly to us. So, um, I know sometimes if I give my email address, people, if you forget the dot or you spell my last name wrong, it'll get lost. So it's easier actually to do the autism one. It always finds its way to me. Yeah, and thanks everyone so much for
thank you
coming, for the
so
great
much.
questions.
Thank you, everyone.
I didn't mean to talk over you too. Thank you so much. Okay. Bye, everybody. Have a great evening.